Prior to having kids, I don't think I ever thought about surgery. I thought I might be that mom that, if I did have kids, that would just have that wonderful body that would just bounce back into the normal shape. But that's not realistic, especially when you have multiple kids. And I started to finding that out with every pregnancy, that just wasn't happening. I had already had the loose stomach after the second C-section. That's when I really tried to diet and exercise and see if I could change that. So after my second child is when I knew for sure that it wasn't going to bounce back as fast as I thought it was, and that I might have to look further to how to change this. After speaking to a surgeon, that's what I realized, that what I had going on was nothing that I could have ever fixed through diet and exercise. I didn't have to really think long and hard about having the surgery. For me, I had exhausted all other outlets. My husband is very pleased with the results. He is happy that I'm happy. That was his main concern. He wanted to make sure that I went through all of this for a good reason, and at the end of all of it, that I was happy with the results, in which I was. My daughter, who I spend a lot of time with, she comes in when I'm changing and model clothes for her a little bit more, whereas before, I spent a lot of time trying to tuck things in.
Natrelle Breast Implants. Important information. Who may get breast implants? Natrelle Breast Implants are approved for women for the following: breast augmentation for women at least 22 years old for silicone-filled implants, breast augmentation for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase breast size, as well as revision surgery to correct or improve the result of a primary breast augmentation surgery. Breast reconstruction. Breast reconstruction includes primary reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. Breast reconstruction also includes revision surgery to correct or improve the result of a primary breast reconstruction surgery. Important safety information. Who should not get breast implants? Women with active infection anywhere in their body. Women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions. Women who are currently pregnant or nursing. What should I know before getting breast implants? Breast implants are not lifetime devices and not necessarily a one-time surgery. Many of the changes to your breasts following implantation cannot be undone. If you later choose to have your implants removed and not replaced, you may experience unacceptable dimpling, puckering, wrinkling, or other cosmetic changes of the breast, which may be permanent. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent and may not be detected by you or your doctor. You should have an MRI 3 years after your surgery, and then every 2 years after that, for as long as you have your breast implants, to determine if rupture is present. If implant rupture is noted on an MRI, you should have the implant removed, with or without replacement. With breast implants, a routine screening mammography and self-examination for breast cancer will be more difficult. Ask your doctor to help you distinguish the implant from your breast tissue. Symptoms of a ruptured implant may be hard knots or lumps surrounding the implant or in the armpit, change or loss of size or shape of the breast or implant, pain, tingling, swelling, numbness, burning, or hardening. Tell your doctor of these symptoms and remove ruptured implants. Inform any other doctor who treats you of the presence of your implants to minimize the risk of damage to the implants. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, for example, lupus and scleroderma. A weakened immune system, for example, currently taking drugs that weaken the body's natural resistance to disease. Planned chemotherapy following breast implant placement. planned radiation therapy to the breast following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Please discuss any history of mental health disorders with your surgeon prior to surgery. Patients with a diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What are some complications with breast implants? Key complications are reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and severe capsular contracture, severe scar tissue around the implant. Other complications include asymmetry, nipple, breast, skin sensation changes, scarring or wrinkling and rippling. Talk to your doctor about other complications. Talk to your doctor. For more information, see the patient brochures at www.allergan.com/labeling/USA/HTM. To report a problem with Natrelle Inspira breast implants, please call Allergan at 1-800-433-8871. Natrelle breast implants are available by prescription only.